Here you are, dear.
Thanks, hon. Could you please put these in the dining room?
Sure.
Thanks. Hi, I'm Kathy. I have an active and wonderful life. But until I had a simple procedure to correct my cataracts, I was afraid that the vision problems I was experiencing were going to change my life forever. Thanks to the skill of my doctor and a remarkable procedure, I can see clearly again, better than I have in years, and I'm back to enjoying life. Let me tell you about it. The first indication that something unusual was going on with my eyes came when I was driving at night. I noticed that oncoming headlights had an exceptionally strong glare. In fact, all the lights I looked at seemed to have a sort of halo around them. My doctor told me that having trouble driving at night is often an early symptom of cataracts. He also said that some people notice that bright colors appear faded and washed out, something I was also experiencing. But the biggest and most frustrating change was when my vision became cloudy and blurred, and I began to have trouble with the simplest of tasks. My husband and I love to play golf and tennis. We try to play as often as possible, but my scores kept getting worse. I just couldn't see the ball as well as I used to. And reading became more and more difficult. My reading glasses didn't seem to help anymore. I attributed these frustrations to growing older, and I didn't think there was anything I could do about them. Then one day, one of my grandchildren complained that I was taking too long to read a story. Even with my glasses, I was struggling so hard to see the words. That's when I knew it was time to see a doctor. It didn't take long for him to figure out what was wrong. Cataracts are one of the most common problems in people my age. He told me that our eyes work much like a camera. Light passes through the lens of the camera and is focused on the film. Our eye also has a lens. Normally, this lens is transparent and lets light pass freely to focus on the back of the eye, called the retina. A cataract is when the lens becomes cloudy and reduces the amount of light that can reach the retina, resulting in blurred or clouded vision. It's just part of getting older. Doctors haven't yet figured out how to prevent or cure cataracts, but they can correct the blurred vision that cataracts cause. They use a very common surgical procedure that replaces the cloudy cataract lens with a permanent artificial lens called an intraocular lens, or IOL. After being placed in the IOL requires no special care or handling. In fact, the only way you know it's there is by the dramatic improvement in your vision. My doctor was confident and reassuring and said that cataract surgery is the most common surgical procedure performed on people over 60, and that it could successfully restore my vision. I confess, though, I was still more than a little frightened about having surgery on something as precious as my eyes. But the prospect of having clear vision again, to be able to drive at night with confidence and comfortably read to my grandchildren, was very exciting. So I decided to have the procedure, and after going through the whole process, I can assure you that having cataract surgery is much easier than you might expect. In fact, it doesn't even require an overnight stay in a hospital. You can come home shortly after the procedure. The nurses gave me reading material about cataracts and took time to answer all my questions. My husband came with me on the day of my surgery. After we checked in, I went to the pre-op area where the nurses helped me get ready. The nurses explained everything that was going to happen. Then they gave me a sedative to help me relax and medication to prevent discomfort and eye movement during surgery. I was quite comfortable throughout the whole procedure, and before I knew it, it was over. It took less than 20 minutes. I'll let my doctor tell you about the surgery itself.
You did great. See you next time. Would you schedule his next appointment? Hello. Cataract surgery has one of the highest success rates of any type of surgery, and Mrs. Wilson's operation was no exception. It was a complete success. During surgery, a small incision was made and a procedure called phacoemulsification, or phaco, was performed. Phaco uses a tiny probe to gently separate the cataract into smaller pieces and remove them from the eye. Once the cataract was removed, I implanted an IOL in Mrs. Wilson's eye. There are several different types of IOLs available. I chose the Acrosoft single piece for her. This unique lens is crafted entirely from Microsoft acrylic, a soft, flexible material. It consists of a round lens called the optic and the haptics, which helps keep the lens in place. This material was developed specifically for the use in the eye and provides excellent long-term results. Microsoft's single piece is designed to conform to the natural shape of the lens capsule, which helps it remain stable and centered in the eye. I also chose this lens because of the unique benefits of its material. Microsoft is very thin and can be inserted through a small incision that is created for the phaco procedure. In most instances, no stitches or sutures are required. It gives me excellent control so I can precisely place the lens in its permanent position to effectively focus incoming light rays. The images you see after surgery are crisp and clear, without the distortions caused by cataracts. Once a cataract has been removed, it can't return. However, over time, patients may complain that their vision has again become cloudy. This sometimes common condition, which may occur with any type of IOL, is known as a secondary cataract and can be easily treated by a brief laser procedure performed in the office. Mrs. Wilson will tell you more about her experience.
Before I knew it, I was resting in the recovery room. I was given a patch and protective shield to use for a short time and a prescription for eye drops and instructions on how to care for my eye over the next few weeks. When my doctor saw me the day after the surgery, he examined my eye and told me everything looked great. Soon I was doing all the things I had trouble with before my surgery. I feel confident driving at night again, and simple things like gardening and being with my friends are more enjoyable. I've noticed the colors of the flowers are brighter and more vibrant. My tennis and golf scores are heading in the right direction. Best of all, my grandchildren don't complain about how slowly I read to them anymore. I'm again living a normal, active life, doing all the things that are most important to me, all because the clouds have gone away and I can once again see clearly. I hope I've helped you feel more comfortable about the prospect of having cataract surgery. I understand from my doctor that my experience was very typical. But remember, you and only you can decide when and if you should have surgery. Consult your doctor and be sure all of your questions are answered. Once you decide that you're ready, be prepared for a wonderful surprise. All the things you couldn't see clearly will be bright, clear, and vivid again. In fact, I would say that I haven't seen life so clearly in years. We're so grateful that my doctor and I have chased the clouds away. I think you will be too.